Hi, it's me, Lindsay, with EquipMeOT, here today to talk about when not to use a gait belt. So I just recently did a video on the basics of a gait belt, what it is, how to put it on safely, and how to use it safely. But this video I want to talk about something a little different, and that is when not to use a gait belt. We call that a contraindication. So sometimes there's folks who just aren't appropriate for these gait belts or in the traditional sense. So I want to go over that. So I am wearing a normal posy style gait belt, and this gait belt is what you would see in most hospital rehab settings, but these cannot be applied to everyone. So the first group of people that you absolutely would not use a gait belt in this capacity with is anyone with abdominal wounds, surgeries, or any sort of extra things like feeding tubes or certain colostomy or ostomy bags. If you put a gait belt in that area, you could run the risk of damaging those incisional areas, potentially causing physical pain or harm to the person who's wearing the gait belt. Just a host of reasons why you wouldn't want to wear this. So this may include folks who have active hernia sites. That could be very painful to place a gait belt over. People who've had recent surgeries like hysterectomies or even liver, kidney issues. Anything that causes pain and discomfort in the abdominal region. It's really important to note the patient's chart if you are looking at using one of these, because there may even be some hidden abdominal injuries that were caused by an accident, like internal bleeding and things like that. So it's really important to know that before you go to apply a rather tight belt around somebody's waist. There are alternative placement options for a gait belt, and this is common. You might see this in certain surgical settings where the gait belt is actually applied high up underneath the armpits. This is not the recommended use of the gait belt, but this is sometimes a necessity in those situations. So you would simply apply the gait belt up to a higher position up here, but it's very important that you're not tugging up on the gait belt. You never want to lift up into somebody's armpit. That's going to cause a lot of discomfort and chafing. So just be aware that if you're putting the gait belt high to avoid abdominal issues, that you're not driving it up into somebody's armpit. That could be very uncomfortable. So that's the first group of people you may not use a traditional gait belt with, and you may have to do alternative things to support them. Another group of people you may consider not using a gait belt with are those with sensory disorders or maybe behavioral or cognitive disorders that make it very, very difficult for them to tolerate gait belts. I've worked with a lot of populations that are dealing with sensory sensitivities, those who have had recent brain injuries, sometimes those in the autistic population, and those with dementia can feel very constricted or uncomfortable with a gait belt, and it can cause agitation and behavioral issues that may be very problematic. And in those situations, sometimes you have to get a little bit more creative. You have to use different types of gait belts. I have one here that I like that is a little bit different. This one has an extra wide belt on it. This one's by Vive. And because of the width of this belt, it displaces the pressure applied to the body a little bit more effectively and can be more comfortable. There's another option out there called a gait vest or support vest that acts like a gait belt but is worn like a vest. And in some situations, that's going to be a better option. Another option is actual wearable belt, as long as it is a very secure belt and you can actually get your hand under it inserted through the belt loops of somebody's normal wearing pants. That can be an alternative as well for individuals who really refuse any sort of extra equipment added to them for their rehab needs. So there has to be alternatives. I've also seen it effective where you take a standard gait belt and decorate it. Make it very visually appealing, and perhaps that will help with buy-in. I've done that with some of my clients and have found that they're less agitated about using something that maybe they've contributed to making it look better. That's especially effective in my pediatric populations. So that's an idea to help make those populations more likely to use this. But be aware, if this causes agitation, the safety risks are extremely high, so you need to take that into consideration before using it consistently. The last group and the last reason you would not use a gait belt is to lift somebody. Gait belts are stabilizing tools. They are not lifting tools. If you are attempting to transfer somebody, stand somebody, ambulate somebody, which means walking them, who needs a ton of physical assistance, perhaps is not appropriate for a single person to lift or move, the gait belt is not going to be your solution. A gait belt can be combined with an alternative solution, like a slide board, for example, or a Hoyer lift system. You wouldn't need a gait belt because that's going to physically lift them, but a sit-to-stand system might be something that you could use a gait belt in conjunction with. And again, the gait belt is really going to be only used as a support, as a balance, and as a place for you to actually be able to provide some input into the person so that they know how to stabilize themselves to prevent falls. So very, very important. That is the key takeaway to this, is never, ever, ever lift somebody with a gait belt, because it could cause physical harm to the person, as these belts can dig into the body, causing bruising or even skin laceration. So I've seen it happen, and it's really devastating when it does. So please, please, please never attempt to lift a person with a gait belt. So there you have it, some reasons why you would not use a gait belt. I hope you got some value out of this video. If you did, consider giving me a thumbs up. As always, if you need more information like this on how to stay safe and independent in your home and community, consider subscribing to EquipMeOT. Thank you.